Hi everyone, this is Dr. Lin of Rehab and Revive Physical Therapy. We have another special edition of knee pain series and how to take care of it. So we have a great exercise today with Stephanie, our special guest from before. And we're going to talk about terminal knee extension exercises, or praying mantis, which my mentor Greg Johnson termed. I think it's an important aspect of walking, gait, even performance. What we need to do is that last 15 degrees, that knee joint has to rotate, like I said before in a previous video, the lock home mechanism or the screw home mechanism, and when you come into extension. So that's the purpose of this exercise. Really try to get those muscles going. Two important muscles that we're going to talk about here is the VMO, the vastus medialis obliquus, and the soleus. For those of you out there, soleus is the only muscle out there that keeps you from collapsing when you're upright and weight bearing. So this is a very important muscle to retrain and have someone check out. So we'll stay tuned and we'll get right to the exercise. All right, so we got the praying mantis exercise. I love the name. So this is how you set up. You have yourself on your stomach. Put a pillow there, just protect your back and make sure you're not using anything. But what the most important thing is to set your foot in dorsiflexion or flexed foot, and you're gonna plant that. And then the real exercise is really short. Like I said, it's 15 degrees. Go ahead and straighten both knees here, Steph. Right here, and then you see this one's really strong. So when I push here, it checks the VMO. When I push here, it checks the soleus. And then, you know, if you check back at the mini squats, she was much worse here. So I would say her VMO is the weaker of the two, but definitely needs some work. So what I want you to do is think about the heel. You're going to slide it back to the back of the wall here, stuff, and then you're going to basically what you're going to try to feel is you want about 40% at your VMO, 40% here, and maybe you're going to get your hamstring in a little bit. And this is a great exercise after your heel slides. Make sure you've got this hamstring kicking in, but what you can do is you can either put a little ankle weight right on this spot and hold it. And your goal is to do this until the shakiness stops. It's a little bit weaker, and I bet you for Stephanie, would you say this is much easier to hold and maintain? Yeah. So she said yes, and this one takes a little bit more effort. So you're gonna do this till it feels just about as equal. And if you have two bum knees, definitely work on doing it. You could do it together, you could do it separately, so you can let this one down, but just work on this one. So I would suggest that, and then we have other exercises for progression, but what we want to do is make sure you're getting this whole line, and that's what's very important. That's going to give you that terminal knee push-off for those of you in high heels, those of you having issues going upstairs and down the stairs. So this is one of the great exercises I love to teach. Great, and you're going to hold it, and I'm just going to help facilitate her a little bit, and there you go. Now it's starting to kick in nicely, so it's a lot more sturdier. Then we'll move on to the progression here. All right, once you have the terminal knee extension when you're laying flat on your stomach, the next one is to find a bed or a couch. Obviously, the higher the surface, a little bit easier on this exercise. We are trying to find the same muscles, the VMO, soleus. You're going to get a little bit of the hamstring. So what I want you to do is think about the heel pressing down like you're gonna squash a bug. But what has happened is you set yourself up, hip at 90 degrees. Go ahead and go back to that. Hip at 90 degrees, and then go ahead and straighten out. And you might feel a little stretch, which is great. I think this is more of a dynamic stretch for those of you who have really tight calves. I think this is a lot better than their static mountain climber stretch. So this is a great progression, and we suggest just doing this. Make sure this is a good exercise for you and you can tolerate it, and check with your medical professional before you start this exercise. So check that out, and then once you have it pretty sturdy, then you can do repetitions. And I would, tell Stephanie to do about 20 or 30 in a row. Is going to burn a little bit in these areas. That's where you want to focus. Make sure it's not coming from anywhere else. All right, you have it. You have a couple ways of doing this praying mantis exercise. Thank you, Stephanie, for coming in, and hopefully she feels a little bit stronger. But this is great for those of you who have some pain, especially when pushing off. Those of you who collapse, every time your foot hits the ground. That's a really important exercise to do, and what you want to do is control your pain with more stability instead of more mobility. Everyone's trying to foam roll or stretch, and I think that's just too much and excessive. So if you like what we're doing, we're going to have more things on knee pain. So stay tuned for Mondays and Thursdays. We're going to throw some more exercises out there. If you're new, please subscribe and leave a comment below if you like what we're doing, and leave a like as well. And so I'm Dr. Lynn, Stephanie, from Rehab and Revived Physical Therapy. Remember, we can and we will get better together.